Hi class, we're on to week 6. I'm wrapping up your videos. I think I'm almost done. I think I just have a few more to do. For some reason, if your video has not been graded, if you could reach out to me, it could be because there was an issue with your link or something of that nature. And it won't be held against you. I recognize that sometimes there were some issues with like the length of the video and trying to submit it on Blackboard, or maybe you or email me earlier with the link. And sometimes Outlook is strange when there's been multiple inquiries about a certain subject, and because you're all CBU emails, it groups the emails together. So for some reason, if you haven't gotten graded and you're concerned, just reach out to me and I'll have no problem taking a look at your video. But from what I watched, very helpful to see. You guys did a great job leading your groups. I really thought you did well with your basic attending skills and just the flow of your group, asking great introspective questions. I liked a lot of the coping skills that were administered. Some of you may have experience already with groups, and that was obvious. But I was very pleased. Great job. I know it was a stressful assignment just because you have to get a group together. I think that was even brought up in one of the groups. Um, but to have the experience is important. And with us not being in-person learning, we need to figure out how to have you have those experiences. And so I know it's stressful and or annoying to try to do this kind of work together and or find people, but it's really beneficial. So hopefully you saw the benefit of having the experience. So today we're going to be talking about the working stage of group. People are going to start working through barriers that they face. Meaningful work and learning occur at every stage of group. However, in the working stage, it's a deeper exploration, right? So we've started with the initial phase, then the transitional phase, and now we're in the working phase. So hopefully we've gotten through some of the, top layers. When I think of skin, like the very top where it's just like a scratch, but we're getting below the surface to get to like the depth and the meat of what we're going to learn about in whatever your topic of your group is. You're going to face people who have a really hard time being vulnerable. That's not abnormal. That's pretty typical. It's scary, right? Like being vulnerable with people you don't know is scary. Sometimes that's refreshing, right? Like being vulnerable with people we know is really hard, but sometimes being vulnerable with people we don't know is scary. And how do I trust them? Because there isn't trust, or I have an issue with trust, whatever that looks like for the person. So for you to be able to get past some of these things is going to be important. So the transition was the interventions demand more from the members. The working stage involves the entire group and a member's personal work. So everyone's kind of working maybe more specifically with someone, maybe investing more, giving more input, maybe sharing personal experiences. Some behavior that we might notice, both support and challenge to take risk in the group, a use of variety of therapeutic interventions, more direct interactions, healing capacity within the group develops, and increased group cohesion fosters action-oriented behavior. So the more cohesive I think your group is, the more you're going to get out of your group. As far as your members are going to get more out of it, which is really great. Conflict in the group is recognized and explored, hopefully, and in a healthy manner. Characteristics of a non-working group: mistrust. Participants are more focused and more on others than themselves. Participants hold back and feel distant from one another, and conflicts are ignored and avoided. And then you got some ugliness in the group. Some of you faced even conflict in your one group demonstration, which I was like, wow, got some assertive group members there. Which again, you're going to face that. So there's no problem in practicing that. But it is challenging, right? It's challenging kind of redirecting people or keeping things focused or trying to work through like what's going on and why the reaction. Choices to be made during the working stage: disclosure versus being anonymous, authenticity versus guardedness. So do I reveal who I really am, or am I more guarded? Spontaneity versus control, acceptance versus rejection, and unity versus fragmentation. those are challenges, kind of like choices group members have to make. As the leader, you're part of like probably helping people feel the urge to want to be more cohesive. So that's something to be mindful of. Like, we hold a lot of responsibility and or influence in that. And so that's why it's important to control maybe some problems from the beginning so that this can blossom, this ability to be vulnerable and open to disclosure and things. Because if we don't nip problems at the beginning, then they're going to get even bigger as time goes on. And that's just going to cause people to shut down. Group is not an end in itself. And so the goal of group, right, of any group work or any therapy even, is we want it to carry on in their life. And so even in group work, we want whatever they're learning, especially if it's a court mandated situation or grief or, some sort of treatment type group. We want what they learn in group to carry on even outside of the group. So we want people to take what they learn and maximize it and apply it to their everyday life. Therapeutic factors that operate in a group: self-disclosure, feedback, and confrontation, cohesion, hope, willingness to risk and to trust, which these are very deep things for some people. Some people don't do that with anybody in their life. And so to be able to do that in a group, that's huge. Catharsis, caring and acceptance, freedom to experiment, humor. All these are things that can happen in a group, which is great, and especially in the working stage. Guidelines for member self-disclosure. Disclosure should be related to the purpose of the group. So we're not just talking about anything, which is helpful because you have those people that just like to talk, and it could be a little overwhelming for those people who aren't like that. And so something to be mindful of. It is useful to express persistent thoughts and feelings. Level and nature of disclosure. Stage of group may determine what is appropriate. Members decide what and how much to disclose. Guidelines for giving feedback. It's not about advice giving, remind you to remember. So give feedback with honesty and sensitivity. Conscious feedback given in a clear and straightforward way is useful. So we don't need to like dance around something. In giving feedback, let others know how their behavior affects you, but avoid being judgmental. And avoid giving global feedback. So some people, right, isn't that the worst? Like, I'll have like clients talk like that and they'll be about like their spouse, and you're like, you mean the person sitting next to you? So let's be specific to what we're talking about, right? That's important. Catharsis is the expression of pent-up emotions. It can be healing and lead to increased cohesions. It is not appropriate for all types of groups. After a cathartic event, it is useful to integrate cognitive and behavioral work. Insights are common. It is crucial to put insights into action. We would like people at least to do that. So this is some information about the working stage, which is, a big part of a group. And lastly, we have the final stage of group, and we're trying to wrap it all up, right? And this might look very different depending on the kind of group. If you have a more open group, the final stage might look different versus if you have a group that has a set amount of sessions. So an open group, educate members to give adequate notice when terminating. Allow time for members to prepare emotionally. So if you know it's going to end, make sure you're preparing people for it to end. Give opportunity to say goodbye. Sometimes people do like a fun, closure type event, or like an encouragement circle, or, different things, like opportunities to really talk about what was learned, what they're thankful for about the group. Maybe there's a potluck, I don't know. But it's going to look a little different for every person, but these are things that do happen. And explore cultural influences on members' perceptions and understandings of endings. And an open group, help members identify how they can incorporate what was meaningful in the group into their daily life. Now, so for some open groups, let's say it's in a rehab setting, maybe it's like they've reached a place where it's time for them to leave and they can't continue group, so maybe it's like, okay, this person's transitioning out. The group is open, so it accepts members at any point in time, but maybe there's a point when people decide to take off or to be done. So just being mindful of that and helping prep people for that. Assist the members to review what they've been learning in the group. Make referrals when appropriate, so maybe get them outside connections. But in a final group, that looks different because everyone's done, right? dealing with separation feelings, compare early and later perceptions in the group, dealing with unfinished business, personal gestures and expressing the meaning of a group experience, and reviewing the group experience. Tasks at the final stage of a closed group. So practice behavior change, carrying learning further, giving and receiving feedback, make sure they're going to use their homework, how to handle setbacks or relapse, right? And guidelines for applying group into your life. And then again, giving and receiving feedback. Here are some examples. My greatest fear for you is, my hope for you is, I hope that you will seriously consider. I see you blocking your strengths by some things I hope you will think about doing for yourself. Some ways I hope you'd be different with others are. So just like encouragement, but also like maybe some constructive criticism or fear, and then processing through that, right? And then we want to be able to apply it to our everyday life, which hopefully group has been leading up to. People do feel like they can apply it to their everyday life. That is important. A group is a means to an end. Change is bound to be slow and subtle. Focus on more changing yourself than on changing others, and decide what you do with what you've learned about yourself. Okay? We want people to be able to apply what they've learned about themselves and hopefully apply it to their everyday life and or situations, which sometimes can be difficult because we can't change other people. We can only change ourselves, but despite our environment, how we want to move forward, because we can control us. And again, evaluation is an ongoing process that tracks the progress of an individual members and the group as a whole. Sometimes there's scaling questions, questionnaires. It might be good as a leader to have constructive feedback about what worked about the group, what would maybe be changed. You could do that in a survey format or some sort of standard format after every group to figure out what worked well, what didn't. So you know how to tweak things or modify or see what works good. Because overall, we want group members to have a healthy and positive experience, and we are part of that journey. So just some things to be mindful of when you're wrapping things up. So I hope you found this class a lot. It is a lot of information in a short amount of time. We have one more live lecture after this. I know I'm just part of your learning. There's so much on the Blackboard, but hopefully it's helpful to kind of hear a little bit of a breakdown. Hopefully it was helpful to have the experience of leading a group and working with a group of people and seeing different challenges that could come up. It's very different than individual, family, or couples therapy. It's very specific, but there's so much healing that can happen from learning from one another. And that's where group is so beneficial for clients. It can be a great addition to individual and or family or couples therapy. So anyhow, I hope you're well. Have a great week, and I'll talk with you soon.